Now only 10 seconds, huh, sir. Sorry for this delay. Just 10 seconds away. We are live on YouTube. Okay. So I'm sharing my screen.
Yeah. Vajanti ma'am,
Now only 10 seconds.
screen sharing stop. Yes.
Yes. Just 10 seconds away. We are live on YouTube. Okay. So I'm sharing my screen. Hope my screen is visible.
Yes, yes.
Okay.
Vajanti ma'am,
Now only 10 seconds.
screen sharing stop.
Actually, काय झालं कळत नाहीये मला.
Just 10 seconds away. We are live on YouTube.
Remove from toolbar.
So I'm sharing my screen. Hope my screen is visible.
Yes, yes.
Stop होत नाहीये.
नाही झालंय मॅडम, झालंय.
झालंय का? हा.
झालंय.
हा, ओके.
Okay.
ठीक.
So good evening, all the respected faculty members, and welcome everyone, all the faculties and all the delegates. On behalf of Corona Remedies, I, Darshan Waghela, welcomes each one of you for this Core Connect live webinar in association with Indian Medical Association Maharashtra State Sexual Health Committee with Association of Maharashtra Obs and Gynecological Society organizes a webinar on sexual health. So I would like to welcome from bottom of my heart each and everyone, all the esteemed faculty members and delegates. I would like to introduce in short our conveners for this today's webinar, Dr. Madan Kamble sir, Chairman of Sexual Health Committee, IMA and MS, Journal Coordinator, AMOGS. Dr. Parul Sauzi ma'am, Co-Chairman, SHC, IMA, MS, and Dr. Rakhi Sarda ma'am, a convener for HSC, IMA and MS. Moving forward to the lamp lighting. So with this, I will hand over the session to Madan sir. Sir, over to you.
Yes, thank you, Darshan. Good evening, everyone. Greetings from AMOGS and IMA both for this special episode, which is organized by Indian Medical Association Maharashtra State Sexual Health Committee in association with AMOGS. This is a special episode organized between these two organizations and on an important subject that is the psychosexual health. And on this occasion, I welcome all AMOGS office bearers, our President Dr. Amey Purandare sir, Honorary Secretary Dr. Rohan Palshetkar, and IMA office bearers, our dear President IMAMS, Dr. Santosh Kulkarni sir, and Dr. Vikrant Desai sir, who is the Honorary Secretary IMAMS. And for this, we are so grateful to have the chief guest, esteemed faculties and guests, Dr. Santosh Kulkarni, who is the President IMAMS, and Dr. Amey Purandare sir, President AMOGS. And also, we are deeply honored to have guest of honors, respected Dr. Raj Brahmbhatt sir, who is the Senior Sexologist and Founder, Trustee and Emeritus CS EPI, and Dr. Manjusha Giri ma'am, the President-elect IMA Maharashtra State, Dr. Vikrant Desai sir, Honorary Secretary IMAMS, and Dr. Rohan Palshetkar sir, Honorary Secretary AMOGS. We are thankful to our Chief Faculty, Dr. Vajanti Patwardhan ma'am, who has accepted our invitation. Thank you so much, ma'am. And ma'am is speaking on a wonderful topic that is reclaiming pleasure, which is a guide to healthy sexual wellness. I welcome all the delegates who have joined from all over the Maharashtra and from the India, from all the organizations, Gynec as well as all the IMA members. We are so lucky to have the galaxy of faculties here. I welcome from my bottom of heart, and I would like to welcome our chief guest, Dr. Amey Purandare sir, who is the president AMOX. He is the one of the dynamic president till date, and he is the wonderful person, very humble and very supportive. We are so much thankful to him, and doing working with sir is actually a great honor. Currently, I am working as a zonal coordinator in AMOX after working for Sexual Health Committee of AMOX, and we would like to have your blessing, sir. Over to you, Amey sir.
Yeah, thank you, Madan, for those kind words. I think it is indeed a great honor and privilege that this webinar is being organized as we are collaborating with one of the most important medical organizations of Maharashtra, that is IMA Maharashtra. It is a pleasure and a privilege to be sharing the stage as chief guest with President of IMA Maharashtra State, Dr. Santosh Kulkarni. This webinar, which is curated by Madan and Dr. Parul and Dr. Sarda, on a very important topic of sexual health and sexual well-being, is indeed something that is the need of the hour. The WHO has recognized sexual health and sexual well-being in its definition of health and wellness. And I think that with stalwarts like Dr. Brahmabhat, who is the guest of honor today, we have learned from his lifetime of practice that how much important sexual health, sexuality, and sexual wellness are a part of not just teaching, training, but importantly, a part of the various problems that are affecting the psychosexual health of our patients. We are also very privileged to have guest of honor, Dr. Giri, who is the president-elect, Dr. Vikrant Desai, who is the honorary secretary, and Dr. Rohan Palshetkar, who is the honorary secretary of AMOX. Dr. Vikrant Desai is the honorary secretary of IMA Maharashtra State and also one of the great supporters of AMOX. Well, we are going to be enlightened today with a very unique topic, that is Reclaiming Pleasure, a guide to healthy sexual wellness, by our chief faculty, the none other than the very popular and passionate Amoxian Dr. Vaijayanti Patwardhan, who is the Vice President of Pune OBGYN Society and Chairman of the PCPNDT Committee of IMA Maharashtra State. Once again, I'm thankful to the conveners, Dr. Madan, Dr. Parul, and Dr. Sarda for having invited me here today. I'm thankful on behalf of AMOX to IMA Maharashtra State for this collaboration. And indeed, it is a privilege of both IMA and AMOX to have legendary figures like Dr. Raj Brahmabhat as guest of honor for this webinar. I hope that the delegates who attend this listen to the various aspects of psychosocial health that Dr. Vajanti is going to deliberate. And I'm sure it is going to benefit you in using these valuable insights in your approach to the patients, not just looking at physical symptoms or just psychological symptoms or clinical symptoms, but also looking at psychosocial and sexual health in priority in treating your patients. Thank you once again, and I wish the webinar a great success.
Thank you, Amey sir, for your kind support and guidance as always. You are always very supportive, and thank you so much, sir, for being with us. Now I request Dr. Santosh Kulkarni, sir, the president of IMA Maharashtra State, and a very good friend of mine. I welcome, sir, for your blessings. Over to you, Santosh, sir.
Thank you, Dr. Madan sir.
Yes, welcome.
AMOX आणि इंडियन मेडिकल असोसिएशन महाराष्ट्र स्टेटच्या संयुक्त विद्यमाने आजचा जो वेबिनार आयोजित केलेला आहे आमच्या IMAच्या सेक्शुअल हेल्थ मेडिसिन कमिटीचे पहिली सेक्शुअल हेल्थ कमिटी आम्ही IMA महाराष्ट्र स्टेट कडनं AMOX कडे बघून आम्ही IMA मध्ये फॉर्म केलेली आहे, अमय पुरंदरे सर. आणि त्या सेक्शुअल हेल्थ कमिटीचे आमचे मित्र पहिले चेअरमन आहेत आणि त्यांच्या अंडर डॉक्टर मदन कांबळे सर चेअरमन आहेत, आमच्या पारुल सावजी को चेअरमन आहेत आणि डॉक्टर राखी सारडा ह्या कन्व्हेनर यांच्याकडनं अत्यंत उत्कृष्ट असं काम गेले नोव्हेंबर पासून चालू आहे आणि आज वेबिनार सुद्धा त्यांनी आयोजित केलेलं आहे. आणि विशेष म्हणजे IMA महाराष्ट्र स्टेट सोबत कोलॅबोरेशन जे AMOXचं आहे आणि आज अमोक्सचे प्रेसिडेंट डॉक्टर अमेय पुरंदरे सर आहेत उपस्थित. डॉक्टर रोहन पालसेटकर सेक्रेटरी, आणि आतापर्यंत बऱ्याचदा सरांचं मार्गदर्शन मिळालेलं आहे ते आपले आदरणीय राजशेखर ब्रह्मभट सर, सिनियर सेक्सॉलॉजिस्ट. त्यांचं पण आपल्याला आज थोडंसं मार्गदर्शन होणार आहे. त्याचबरोबर आमचे डायनामिक सेक्रेटरी IMH चे डॉक्टर विक्रांत देसाई सर, प्रेसिडेंट इलेक्ट डॉक्टर मंजुषा गिरी मॅडम, ट्रेझरर डॉक्टर अमोल गीते सर, आणि सर्व सेक्शुअल हेल्थ कमिटीचे मेंबर्स. आजचा जो टॉपिक आहे तो अत्यंत महत्वाचा सायकोसेक्शुअल हेल्थचा विषय आहे. आणि विशेष म्हणजे आमच्या PCPNDT कमिटीच्या चेअरमन आणि अष्टपैलू व्यक्तिमत्व डॉक्टर वैजयंती पटवर्धन मॅडम, ज्या प्री आणि पोस्ट मॅरेज काउन्सिलर पण आहेत, आणि त्यांचा अत्यंत महत्वाचा हा टॉपिक आपल्याला सर्वांना ऐकायला मिळणार आहे. तर मी जास्त काही वेळ घेत नाही, आज आपल्याला संवाद साधता आला. डॉक्टर वैजयंती पटवर्धन मॅडमच्या वेबिनारला मी शुभेच्छा देतो. धन्यवाद डॉक्टर मदन, थँक्यू.
यस, थँक्यू संतोष सर. वेळात वेळ काढून आल्याबद्दल आणि शुभेच्छांबद्दल धन्यवाद. Now I welcome our guest of honors, respected Dr. Raj Brahmbhatt sir. May I have the CV of Raj sir? Yes. Sir is a great person, great mentor to many people, and he is the senior most person, what I suppose, in the field of sexology. He is the professor, I think sir is the professor in sexual medicine awarded by IMA, National IMA. And congratulations for this
Thank
too,
you.
sir. Yeah, sir is the founder and trustee and emeritus at CSEPI. Also, he is director at Kama Institute of Sexual Studies, and he is pioneer in this field. And he has got lifetime achievement awards like Golden Lamp Award, LB Kriplani Lifetime Achievement Award. Also, he had exhibition called Erotica in the 7th World Congress on Sexology, India. And he had a film at Khajuraho, a symphony in stone. And he has conducted so many workshops in many countries. So I'm very delighted to have you, sir, and we need your blessings. Over to you, sir.
Namaskar and good evening to all of you. First of all, practicing sexual medicine, not 42, now I have become 46 years.
Yeah.
And I am still, with the blessings of all of you and good wishes, I have not crossed 18. I am still in my teen. There is everywhere stress is there. And in this stress, somebody can think about a sex is the most beautiful thing. One side, we have forgotten Ukraine and Russia. Trump is making us dance every day up and down. Diesels and petrol prices are burning. And the whole India has become an oven. But in this heat, somebody thinks of a hot topic. It can be none other than Madan Kamble. He's my close friend, well-wisher. Let me tell you, Madan means one of the name of Kamdev. And today I realized that his surname is Kamble, so the Kam is also there. And that is why he cannot think anything more than 24 hours about sex, sex, and sex only. Now, suddenly, in the month of May, Madan Kamble brings out a very beautiful topic of reclaiming pleasure, a guide to a healthy sexual wellness. Normally, if you remember obstetric gynec, we are only taught about the negative aspect, STDs, unwanted pregnancy, teenage pregnancy. But somebody can think about sexual wellness. And I always say, if you are sexually fit, you are physically fit. And suddenly I feel like in a Sahara desert, I'm traveling. And suddenly I see that the rain shower comes. And that is over today. I recollect 25 years back or 30 years back, Dr. Nagarkatti, a gynecologist, he had organized a meeting. And there I was called to speak on the infertility. Dr. Mahapatra was there. And he said it's a time to include the sexuality with the OBGYN. Later on, after 3 months, there was changing perspective of sexuality from puberty to menopause. I was about to talk. And Madam Motasha, a towering personality, she said, and I'm very happy, today Trimurti, that is Madan, Apurva, and Neeraj, And all three of them have started in a most beautiful way of work. And apart from Teen Dev, that Trinity, there are three Devias also. Parul, Riddhi and Naisargi. I'm extremely happy that you have taken really a torch in the hand and you are marching ahead. And let me tell you, apart from family physician, somebody who is in close relation with the family is you people. The moment child is born, you are the first person to see. At the time of puberty, you see them. Before marriage, you see them. Whether the advice about the contraceptives, pregnancy, unconsummation. So you are the best people. So I would request all of you ask one question. How is your personal life? And you will be able to find lot many problems and you will be able to make not two people happy, but two families happy. They say Hashya na samay pe na. So in the last, I'll say one small said that during our college days, there was no what you call internet or anything. So we were discussing whether sex is a pleasure or a pain. So one of our brilliant students said, it must be आनंद pleasure. क्योंकि अगर गद्दा मजूरी नहीं होती तो हमको देते बॉस ने कभी हमको प्लेजर के लिए नहीं बोला तो सेक्स इज अ प्लेजर आई विश यू ऑल द बेस्ट keep it up and you are doing wonderful job. God bless you. And Madam Vaijanti, last word. Modi ji is giving melody and also, that from Bengal, Jalmuri. So now you give the missile of Puneri to all the people. Unfortunately, I'll be leaving for Kabir's play. From sex to sannyas, I am going. Thank you very much. Wish you all the best. Take care.
Thank you, sir, for your kind words, blessings, and love always. Thank you so much, sir, for taking time from your busy schedule and you're having program at 8 p.m. Thank you so much, sir.
Thank you.
Yeah, I welcome our second guest of honor, Dr. Manjusha Giri, ma'am, who is the president elect IMA Maharashtra State. I welcome Manjusha, ma'am. She is the dynamic lady and first lady president elect of IMAMS. We all are so lucky. Entire Maharashtra is so lucky to have a lady president IMA Maharashtra. I welcome Manjusha, ma'am, and over to you for your blessings.
Namaskar. Thank you, Madan Kamble sir, for inviting me as a guest of honor. First of all, I would like to congratulate IMA Maharashtra State and AMOG's office bearers for organizing such a most needed CME on topic reclaiming pleasure, a guide to healthy sexual wellness. And chief faculty is to Dr. Vaijayanti Patwardhan. She speaks very interestingly. Uh, we will hear her in this CME, and congratulations to all. Thank you. Thank you for having me here, and all the best for today's CME. Happy learning.
Yes, thank you, ma'am. Thank you for being with us. Over to Rakhi. Welcome the next guest of ours. Yes.
Yes, sir. I will like to introduce our next guest of honor, Dr. Vikrant Desai, sir. We all know, sir is an honorary secretary of IMA Maharashtra State, Vice President at Association of Medical Consultant Mumbai, past treasurer of IMA Maharashtra State, past Vice President of Maharashtra State branch at IRIA, past President of IMA at Mira, trustee and Vice President at Mahendra Medical Association. He's been a director and consultant at many places. Sir, please enlighten us with a few words, sir.
Thank you, madam. Respected chief guest, Dr. Santosh Kulkarni, sir, President IMA Maharashtra, Dr. Amay Purandare, sir, President AMOGS, guest of honor, President-elect IMA Maharashtra, Dr. Manjusha Giri, madam, Honorary Secretary AMOGS, Dr. Rohan Palchetkar, sir, Dr. Raj Brahmabhat, Senior Sexologist, members of the Sexual Health Committee of IMA Maharashtra State, Chairman Dr. Madan Kamble, conveners Dr. Parul Sauji, and co-convener Dr. Rakhi Sarda, and all the dignitaries, distinguished colleagues, respected faculty, and dear friends, good evening to you all. It is my privilege to welcome you for today's webinar on sexual health. Sexual health is not a side topic, it is a core to overall health, shaping relationships, mental well-being, and quality of life. Yet, stigma, silence, and misinformation keep many from seeking care. As physicians and health leaders, we have a duty to change that narrative with compassion, evidence, and clarity. We are deeply honored to have Dr. Vaijayanti Patwardhan Madam from Pune as our faculty. She brings decades of clinical experience and expertise in this field of medicine. Her guidance will help us enormously. Let us use this webinar to strengthen our commitment to educate, to destigmatize, and to improve the sexual health of individuals and families across Maharashtra. Thank you and all the best.
Thank you so much, sir. We will like to introduce our next chief guest, Dr. Rohan Parshetkar, sir.
Thank you so much, Dr. Rakhi Sarda ma'am.
Yes, sir.
I think everyone has said such beautiful words, and I think sexual health is a topic which is not spoken about very openly. And I'm glad that we're doing a collaborative effort between IMA State of Maharashtra as well as AMOGS as well. I think the best way to move forward is together. And I'm so glad that Dr. Madan Kamble, Dr. Parul Sauji, and Dr. Rakhi Sarda ma'am are doing this in collaboration together in order to move this topic ahead. I think it's an important topic, and we've got Dr. Vaijayanti ma'am, who's going to give us so much knowledge on this topic, and it's something that's really not discussed about. I also want to appreciate the work that IMA Maharashtra has been doing in the medical education, public health awareness, the ethical practice, and more recently, I'm so happy that they've taken such a strong stand on safeguarding the standards of modern medicine and patient care. So I'm really grateful that we are able to collaborate, and I look forward to many such more collaborations as we go ahead. So Vaijayanti ma'am, thank you for accepting this talk, and we're really looking forward to it. Madan Kamble sir, Rakhi ma'am, Parul Sauji, I'd like to hand it over back to you all. Thank you very much.
Yes. Thank you, Dr. Rohan. Thank you. Taking this opportunity, I welcome the senior stalwarts and Dr. Utture sir, Dr. Jyoti Chilgupkar madam, who have joined for today's particular session. I welcome on behalf of IMA. I also welcome Dr. T.S.S. Rao sir, great stalwart name in the field of sexual medicine from Mysuru, Karnataka. And I welcome all the seniors, faculties, and from IMA Maharashtra and from AMOGS, and all the delegates who have joined for this particular today's session. Now we will move forward for the scientific program. All are waiting to listen our speaker today on a fantastic topic. May I have the CV of Vaijayanti ma'am?
Am I audible?
Yes, ma'am.
Yeah. So, good evening, everybody. Respected chief guests.
Ma'am, let me introduce you.
Okay.
Ma'am is currently the Vice President of Pune OBGY Society and the Chairman PCPNDT Committee of IMAMS, and also member of GPR Committee of PCPNDT Maharashtra Government. She is working on many committees like MTP Committee, PCPNDT Advisory Committee, MMC Scrutiny Committee, and POSH Committee also. She is also invited speaker at many places, and she is also past president of IMA Pune. Over to you, madam, for your talk.
Yeah.
Thank you so much.
Thank you, Dr. Madan Kamble. Respected chief guests and the organizing team, President IMA Dr. Santosh Kulkarni, President AMOGS Dr. Amey Purandare, the chief guest, the guests of honor, in front of whom I'm getting the opportunity to present myself, Dr. Raj Brahmabhat sir, though he could have left by then, I don't know, but then it's really my privilege and real honor to speak in front of him. And other guests of honor, my dear friend Dr. Manjusha Giri, Rohan Palsetkar, and Vikrant Desai, and above all, the coordinators and conveners of this program, Dr. Madan Kamble, Dr. Sarda Madam, and Dr. Rakhi. So it's indeed my privilege, proud privilege and honor to be here to speak on this joint platform created by AMOGS and IMA Maharashtra State, both the organizations very close to my heart. And on the topic, which is not much spoken, especially in the lay people. And of late, whatever Dr. Madam has just introduced me, so the YouTube channel, whether it is my YouTube channel, whether it's my radio talk series, or whether it is the articles which are published. So whenever the topic of sexuality comes, believe me, I keep on getting so many communications, the phone calls or emails related to the personal queries and problems. So that shows the need of what is needed at this particular age, especially in the era where everyone is bombarded with knowledge from various sources, the digital media, but yet the sexuality is not that commonly spoken about, though people have the knowledge mainly from the social media and from the internet, but still that leaves so many queries and problems in their personal lives, and that forms the majority of clients which visit my counseling center also. And I thank Dr. Madan and the entire team for giving me the opportunity to speak and share a few of my experiences with all of you, which are related to reinventing our own sexuality, whether it is our sexuality or our client sexuality. It's very, very important in today's time. Give me a moment to share my screen. I'll start with the presentation. Is my screen visible?
Yes, madam. Yes. Make
Can you
it
see?
full screen. Make it full
Sorry,
screen.
I'm not able to see. Yeah.
Below there is icon at the bottom. खाली खाली आहे.
Yeah. तुम्हाला दिसतोय का? स्क्रीन दिसतोय माझा?
हो स्क्रीन दिसतोय. खाली ते क्लिक करून हे करा ना फुल स्क्रीन.
स्क्रीनवरच क्लिक करावं लागेल ना सर.
काय होतंय?
स्क्रीनवर क्लिक करा मॅडम तुमच्या. हा.
I think now it's come.
येस.
दिसतोय का? आता स्क्रीन दिसतोय?
दिसतंय.
हा त्याच्या फुल स्क्रीन हा त्याच्या शेजारी इकडे राईटला नाही एकदम राईटचा. हा येस नाव इट इज
स्क्रीन दिसतोय आता? राईट.
फुल. येस.
I'll minimize the screen. Yeah. Sorry. So the topic is about sexuality, reclaiming the pleasure, a guide to healthy sexual wellness, the modern intimacy issues in the era of stress, screens, and science. So I'll be talking about some scientific facts and mainly about the experience with respect to whatever my clients or my patients discuss with me at my center and wherever I go, I'm visiting to speak on these topics. So why is this topic important? See, rising sexual dissatisfaction despite of the digital connectivity. Today's world, everybody is all the time busy on their screens, right? So we are virtually connected with so many people. But when it comes to personal or emotional connection, there are hardly any places where we are connected. And that's the reason that inside most of the people feel very lonely, and that is why the dissatisfaction, because it does affect the sexuality of individuals. So the stress, lifestyle disorders, and relationship fatigue is the mainstay of today's time, and that is the reason why people face so many issues related to sexualities. Another additional thing, especially for younger and maybe the senior population, is about pornography. Porn myths versus reality. That is one biggest conflict in today's time. And that is a reason, one of the major reasons why people are not happy with respect to sexuality with their own partner or partners. And there is a need for evidence-based sexual wellness, which people are lacking. Everybody is interested in knowing about sex. They try to get the information also, but they are not able to feel themselves good with respect to their sexuality. And that is why evidence-based sexual wellness is very important, which needs to be discussed and at times taught to the patients. So, as we all understand, sexuality is the central aspect of being human throughout our lives. आपण म्हणतो ना, माणसाच्या आनंदात आयुष्यातले दोन सगळ्यात मोठे आनंद, जे एक म्हणजे फूड खाणं आणि दुसरं म्हणजे सेक्स. तर या दोन्ही गोष्टी ऍट पार असतात, असं थोडं बोल्ड स्टेटमेंट या ठिकाणी मी करू शकते. बट सेक्शुअलिटी इज नॉट जस्ट limited to intercourse. It's much more than a sexual intercourse or the act of intercourse. It is a blend of biology, psychology, emotions, and in Indian setup, especially the culture. Now, culture is something which poses so many restrictions and so many expectations from each other and from a particular individual by the society and by the communities. And that is what is creating even more problems, because a lot of cultural beliefs and systems, they restrict us from the open discussion or openly talking or availing any help if there is any issue. So sexuality in general includes the identity, the intimacy, affection, and of course, above all is pleasure. Sex and pleasure, these two are things, these two words are synonymous. So I can again make a bold statement that sexual wellness equal to overall wellness. So this is applicable to most of us, most of the people who are active in today's world, irrespective of their age. About the age and sexuality, I'll be talking after some time. So sexuality involves thoughts, feelings, behaviors, relationships, and values, and not just the physical act. This is something very important, because whenever any dissatisfied couple, they come to me, the first thing is that they are not happy about the sex. Now, why they are not happy is something which we will be discussing, and then how to regain the happiness or the content of sex. That is something, are the things which we need to educate our patients and educate our clients. So, as we know, sex is a pleasure for men as well as women, but there are some differences with respect to the ideas and practices of sex or sexuality. And that is why I put the word versus. It's Mars versus Venus, right? We all are aware of such type of terminologies. So what happens? There are only broad examples which I've quoted here. For men, it is more visual triggers. A simple erotic picture, a sexy lady, somebody's thought in the mind, that also can trigger the sexual arousal as far as the man is concerned. And the arousal is much faster as compared to a woman. But another part of it is, especially in today's times, is the performance anxiety, which is again very, very common, especially for all people who are so busy in their careers and in their day-to-day routines. What about females? What is the basic domain of females in today's time? Females have more of emotional safety, which is needed, which matters deeply. If a woman feels safe with a particular man, then only she'll be happy to enjoy sex with him. The responsive desire of female is what is different from men, and the context changes intimacy. Example could be a woman who has a child who is, say, 10th standard, 12th standard, and even if she's with her husband in the bedroom, she is not very comfortable, or mentally she can't come out of the thought that tomorrow is my son's prelim or something. So that is going to affect the intimacy. So this is how the male and female sexuality does have some differences. And this is something which every couple or both the partners should understand. One more thing which I want all the men to pass on to yourself and all ladies who are present here to not pass on to their partners, but then yes, be happy that everything is, whatever I'm going to speak is all evidence based. So there are evidences that nothing reduces the libido faster than hearing snoring of your partner. It takes only 14 seconds. Okay. If your partner is snoring in the bedroom, within 14 seconds, especially the female's libido is going to drop down. So both the partners must realize the differences and the expectations when it comes to sexuality or whatever expectations are there from your partner. So little bit of brushing up of our physiology and the scientific things. As we all know, there are 4 basic stages of sexual act or sexual responses. It is not just a physical act, but it's a dance of mind, body, hormones, emotions, and connections. This is the key line of my presentation, I would say, that we have to focus on all these things. So as we all understand, the 4 basic stages of sexual act are, first is desire. Now desires किंवा इच्छा ज्याला म्हणतो, इच्छा हे सृष्टीच्या उत्पत्तीचं मूळ आहे असं म्हटलं जातं. इफ वी स्टडी द मायथॉलॉजिकल बुक्स अँड ऑल, वी नो दॅट इच्छा ही सगळ्यात पहिली गोष्ट असते की ज्यामुळे आपण कुठलीही गोष्ट करायला प्रवृत्त होतो. We all do anything because there is a desire. So as far as sex is concerned, desire is very important. Desire of both partners is also very important. Medically, that it is the desire for sex is termed as libido. We all know that. The next stage is of the arousal or excitement. Now, during this phase, physiological and bodily changes occur. Like, for example, for a man, erection is there. For a woman, erection of the clitoris or the breast nipples, that is there. But more importantly, it is the lubrication which is required during the sexual act, for which the vaginal secretions and other physiological changes occur even in a woman. Third stage is the orgasm or the climax. Now, why is sex so important? It is, people look at the climax, which is called as orgasm. As far as man is concerned, most of the men will experience orgasm at the end of the sexual act. For females, achieving orgasm or climax is not that common, and it's not an everyday or every time happening. And this is something men and women both need to understand. Last but not the least is the phase of resolution or relaxation. And what happens in most of the couples? This is the commonest resolution phase in our society. And as you see here, the man is snoring with mouth open immediately after discharge. And the lady who has not achieved the orgasm, she is looking at him with frustration, with anger, whatever. And that is why after play also is very important. And that could be one way to satisfy the female, even if she has not achieved orgasm during that particular act. We all are aware of Kam Sutra, the ancient Indian Grantha, which is the basis of sexuality and sexology, right? So Vatsayana and Kam Sutra, the words and the poses and everything is known to almost everybody who has experience of sex. So, but then what happens in reality? In today's time, especially, in the previous figure, see, you can see so many figures which are known to Indian society for ages and practiced also at that time, what we are seeing in today's porn and such type of videos, but they are all documented things in Vatsayana's Kama Sutra. But what happens in today's time? The most common position in modern marriages today is one partner is sleeping and the other one is scrolling the mobile. This is the basic of many of the sexual issues and why there is a need of reinventing the sexual pleasures. Intimacy today competes with basically deadlines, depression, and discounted online shoppings. And this is the reason why so many couples face the bedroom blues, or what is not giving them the entire happiness or the concept of happiness. And these are the type of clients which visit me as a consultant for solving their problems. And you see so many types of problems are experienced by the couples. Now, how does the modern lifestyle affect the libido? So just see the lifestyle statistics. As we see here, the chronic stress, the poor sleep pattern, which is less than 6 hours, diabetes and other medical conditions, and obesity. All these things will have a profound effect on the right from libido to performance. And that leads to reduced sexual satisfaction. And that is why when it comes to management, understanding the lifestyle statistics is very important. One more word of caution is excessive pornography exposure. This is associated with rising performance anxiety in younger males for sure, because they are more into watching pornographies and practicing them. But it is seen at all age groups. And even the elderly are not an age bar, but maybe their way of gratification could be a little different when they're watching porn films. The modern aphrodisiac, again, as a sexologist, is this is something which I definitely tell to all the couples is today's aphrodisiac for you is actually 8 hours of sound sleep, and which is difficult to practice and difficult to execute for many working and high profile partners. Impact of digital era. Digitalization has definitely been a boon to all of us, but yes, it does have negative effects on the overall relationship and sexuality. One thing is about the porn, which I just mentioned in the earlier slide. What happens is because of the porn videos, it induces unrealistic expectations. And that is why the happiness related to the pleasure which could have been otherwise obtained from your partner may not be sought, because the comparison is what they have been seeing in the porn. Emotional disconnect, because all the time your attention, this is आपण सवत म्हणतो की नाही मराठीमध्ये, तसं सवत किंवा सवत्या असं काम हा मोबाईल करत असतो. And obviously when the time is there for intimacy or for getting closer to each other, if that time is divided because of the social media and because of mobile for your, even if it is your office work, it is a distraction and definitely not welcome by your partner. Next thing, which is a common trend in today's time, is the dating apps. Dating, again, a casual relationship and going into intimate relationships is very common. But when people frequently use that particular app and keep on changing their partners, it does cause emotional fatigue. So, and last but not the least, the virtual intimacy is replacing the emotional intimacy. So how big is the problem? So as you see here, the details of statistics is mentioned here, but almost 1 in 3 couples report reduced intimacy due to stress and lifestyle. And almost 50% of the men, especially as they cross 40s and 50s, they experience some degrees of erectile dysfunction. As far as women are concerned, 40% of the women, they express dissatisfaction and sexual dysfunction during their lifetime. So the total magnitude is very high, but only 10 to 15% of the patients actually seek for advice from a qualified counselor or a consultant. Now, again, the statistics here. Today's performance pressure, again, my experience of 20-25 years, the performance pressure starts in the boardrooms, and for doctors, it is the consulting rooms, and follows men into their bedrooms. This is very unfortunate and needs prioritization and attention. Now, as per the statistics, many women experience, especially in the menopausal age group women. Now, what happens? A woman in her early 50s or late 40s starts experiencing the climacteric symptoms. Again, the hormones are there, which will lead to vaginal dryness and painful intercourse. So she will like to avoid intercourse. What about her partner or the husband? They are not entered the andropause. And that is why the husband is fully active and expecting sex. But then he also experiences some sort of erectile dysfunction due to some medical conditions. Now, what happens? Because of the problems which they don't like to discuss across, it is the avoid response, right? Fight or fright. This is the commonest type of human responses. Same thing happens in the bedroom, and that creates a big rift in the relationship, even of the husband and wife. Don't feel, don't put me as an exaggerating or megalomaniac, because I can quote you. I can say that almost 70% of the couples in their 50s and later half of their life, they are mentally and emotionally divorced, though they may be staying together in the same house under the same roof, carrying out their other day-to-day activities, but in bedroom, they have different beds, they have different bedrooms, and this is very sad thing, and I definitely take a lot of time to counsel them and to make them understand. Most of the women, again, like any other symptom, they tolerate the symptom silently until Google, which is my biggest competitor, I would say. They like to Google, those who have the access and now the knowledge about how to use. They'll keep on finding the solutions on Google because they feel shy or they don't want to discuss the issue with a doctor. We still hear about many sexual myths. The big commonest, one of the common myths I've included, that real men are always ready. Now, this is something which is the wives or the females must understand, that men are not always ready. It is not. And don't feel paranoid. Don't keep fighting that why you're looking at some other lady or you're so friendly. It's not the desire to sex all the time. This is what I mean to say. And second myth is women lose their desire after marriage, after childbirth, or after, in the menopausal age. Even that is not totally correct. There could be some phases where there are changes in the libido, but it is not a permanent thing, and it could be really related to the temporary this thing. So let me tell you scientifically that the brain is the biggest sexual organ. Why? Because dopamine, all the hormones are and their precursor are secreted from the brain. Like dopamine is important for desire, oxytocin is a love hormone, so needed for bonding between the partners. The serotonin is the mood enhancer, right? And chronic stress rewrites the intimacy circuit. So stress is a negative hormone, as all of us know. So the hormones which are important in sexual function are testosterone, estrogen, the thyroid hormone, the prolactin, the oxytocin, everything. But cortisol, which is the stress hormone, is the silent intimacy thief. So, which are the commonest sexual dysfunctions in men? It is the erectile dysfunction, the premature ejaculation, low libido, and performance anxiety. And in women, we see dyspareunia, low desire, orgasmic difficulties. Now, many of the things will be taken for granted that हे असंच असतं, सगळ्या बायकांना असंच होतं. This is what is the concept which the lady is carrying. But then, yes, the counseling does help for most of these conditions. And hidden sufferings. Many a times the dyspareunia, the husband's wish, the unwanted type of sexual activity, all these things the woman keeps on tolerating and bearing, but with a lot of hatred or dissatisfaction. So, as we know that the sexuality does have this thing, age related issues. Like in 20s, it is the 20s is the age of exploring, experiencing, and experimenting. 30s is the age for stress, multitasking, settling in the career. 40s is the hormonal shifts and medical diseases entering into your life. And 50s and 60s are reinvention, companionship, and mindful intimacy. And this is the area where all of us can help our clients. These are common expressions like in 20s, they say, am I good enough? And in 40s, why am I feeling tired? My wife wants it, but I'm not interested, right? So I'll just quickly go through this because I think we may be running a little short of time. So the common issues which a man faces in his 20s would be performance anxiety, own influence expectations. Some of them are really, repetitions. Now, body image insecurity. This is very important. As we know, watching films, watching movies, and watching models, the concept of the length of penis, the how long the intercourse should take place, all these things are fitted in the mind of, especially in the adolescent age group and the young adulthood. And that is why all these things will reduce the confidence of that particular uh, man, and then that will have a lot of effect on his performance. Casual relationship fatigue. As I told you, most of the youngsters are nowadays, you see so many relationships, and that is why they are very casual. And that is the reason that at some particular point, they feel fatigued of this relationship, and that can lead to sexual problems. And lack of emotional maturity. Who is there to guide them? Most of the times, the children are not that connected with the parents also. And that is why emotional maturity is something which the virtual media cannot give you, virtual companions cannot give you, and that is where the role of counselors or the doctors come. Of course, the parents or anybody who's close to the person are the most important people. So in 20s, the experience is low, but the confidence is of Olympic level, and then they enter into relationship. In 30s, the romance often requires a calendar schedule because there are so many to-do lists and so many things to match the rat race. But ultimately, it leads to the relationship monotony and the sexuality issues. What happens in 40s? The common issues are related to hormone changes, the wealthy lifestyle syndrome, the metabolic syndrome, the weight gains, the declining testosterone. Everything will have an effect because the libido starts negotiating with cholesterol. Unless you are mindful and you are particular about exercises and keeping yourself as fit as the models, role models. In 50s and beyond 50s, nowadays the lifespan is much higher. It is late 70s or 80s. And believe me, the last week, my article, which was published in Lokmat, I got at least 10 to 12 phone calls, 6 of which were of the people who were above 75. And the most elderly person was 86 years old, who expressed that he sometimes feels like having sex, but he is not able to get any erection. So these type of things. So age is just a number, especially applicable to sexuality. And the common, I would say, a word of wisdom here will be the emotional intimacy is very strong at this particular age, and it is very deep also. So sexuality does not retire at 60, though a person may be retired from his job or from his commitments. It becomes wiser, and that is something which we need to counsel to our couples also who seek for the advice. So in general, when we have to deal with the sexuality problems, the lifespan approach is very important because the wellness means different and wellness can be achieved differently at various ages. What we need to do is we need to take a detailed history, the lifestyle evaluation, which is very important, the hormonal assessment in few cases, and medication review. And most importantly is the relationship dynamic with whom they are facing this problem and any other facet related to their personal relationship. So the management strategies will be based on the causes which we identify by all these processes, and which include everything like lifestyle correction, the couple counseling, therapies like cognitive behavioral therapy and mindfulness, which is a part of counseling. But there are organic treatments also which may be needed depending on the cases, like pelvic floor therapy. The lasers and vaginal surgeries, they work wonders in few of the cases who may need, and fortunately they are available in all metro cities. Evidence-based medications, of course, they do have a role in managing the cases. So all of you must have heard the clinical assessment tool, which is the PLICIT model. Now, P is permission. That means making the patient little comfortable and confident, and we can discuss with them, because most of the times the couple doesn't come saying that we are facing a sexuality issue, right? So they will come with some vague complaints, and we have to make them comfortable by telling them or permitting them to open up about their sexuality issue. And that is something like I would share how I counsel the patients. I tell that, few of my patients who have similar complaint like abdominal pain, they also experience some sort of pain during their sexual relation. Is it that you also face something like that? So such type of questions, depending based on the patient's understanding and your reading about their body language and what they communicate, it helps. That is giving permission. Then limited information, they come out with some problem, like for example, menopausal lady tells you that she has dyspareunia. It's a painful intercourse which she likes to avoid. So we need to understand that her, because of the hormonal deficiencies, she's facing vaginal dryness, which could be a cause for her dyspareunia. So the limited information why she's facing her problem. Then next we go to the double S, that is the specific suggestion. Like I may prescribe an estrogen cream apart from other foreplay related things which will solve her problem. And last but not the least, IT is the intensive therapy, which may be required and reserved for some number of patients who have some organic problem. So where is the role of gynecologist and physician? Do we have the role? Of course, I will say that anybody who has scientific knowledge and who has expertise and experience is a person who can give solace to the couple who is in distress. And in the first slides itself, I've told that sexual wellness is equal to general wellness for anybody in today's time, right? So if the patient has presented to us, in irrespective of our specialty, we need to create a safe space so that the patient will or the couple will open up about their personal issues. Then we have to normalize the conversations. Okay, don't make them feel that, oh, you are facing such type of problem. Our own body language, our own communication is very important. That is where we need to learn the conversation. Screen proactively. We need to realize that the symptoms or the presenting complaints may be anything, but the underlying cause is the disturbed relationship and disturbed sexuality. And use compassionate language. This is something I think most of us, they do that. And as I've put the upper part of my visiting card, and that is Healing Space is the name of my counseling center. Our tagline is don't suffocate, speak up. So what people need is speaking up. And these are the two articles which were published in 2 subsequent weeks. One was about the male common sexual problems in Lokmat, and second was in female. Believe me, for female sexual problems, I received only 2 phone calls. For men, I've received 12 to 13 phone calls, of which 10 counselings I've done online because I don't check any of the male patients. So we come to the last few slides. Most importantly, and where most of us lack in giving this particular suggestion or counseling or advice to the patient, is the importance of communication. So communication is the missing aphrodisiac in almost all the couples who face some sexuality issues. So couples discuss the EMI more than the intimacy amongst themselves also. And that is same thing happens when they come to us also for seeking for some advice. So open communication improves the satisfaction. Even if one of the partners is having some physical problem or some medical condition, the communication can solve the दुरावा जो आलेला असतो इंटिमसीमध्ये त्यांच्या जो ब्रीच आलेला असतो तो ब्रीच व्हायला communication is the key to success. And as far as we are concerned, listening itself can be very therapeutic. They want to speak. They want to speak. Whom do they speak? So if they know that this person can help me for getting solution to my issues, even simple listening and then agreeing, yes, I can understand. You are suffocating because of this problem. These 2-3 sentences will give a lot of confidence, and the couple or the man or woman will open up and tell you everything, whatever issues they both are facing. This is something, the science of touch. Now see, आपण गाणी ऐकतो म्हणजे आपल्या जी पंचेंद्रिय आहेत, राईट? तर त्या पंचेंद्रियांचं बाकी सगळी इंद्रिय जी आहेत ती आपण सेव्ह करून ठेवतो. आपण मोबाईलमध्ये आपल्या मेमरीज बघतो, आपण गाणी ऐकतो, आपण वास अत्तर सेंटच्या परफ्यूमच्या बाटल्यांमध्ये हे केलेलं असतो. बट व्हॉट अबाउट टच? टच कॅनॉट बी सेव्ड, राईट? आपल्याला आत्ता पण आठवतं आपल्या आजीने आपल्या चेहऱ्यावरून हात फिरवला असेल लहानपणी, तो स्पर्श नुसतं आठवलं तरी आपल्याला बरं वाटतं, राईट? सो टच एक देर वॉज वन बॉलिवूड मूवी, शबाना आझमी अँड नसीरुद्दीन शाह, स्पर्श. People, the blind people, for them the touch is so important, right? So that is what was shown in that particular movie. But the science of touch is very important. A simple reassuring touch can take care of so many communications, you know. It is not the sexual touch. Sexual touch, of course, to arouse, to give satisfaction, to achieve orgasm, all these things are important, but the non-sexual touch, that is very important to improve the bonding between the partners. See, no intimacy or no sex can give you satisfaction if you are not bonded emotionally. And that is where the role of non-sexual touch comes. Simple hand holding or a pat, or if somebody is crying, just put your head on their shoulder, or putting the head in the lap of your partner. So much of comfort, so much of bonding just by these non-sexual touches. Hug therapy, all of us have seen the movie Munna Bhai MBBS, right? Jadoo Ki Chappi. Any dispute, any dissatisfaction, a simple hug can reduce the stress hormone and it gives assurance to the other person that yes, that person is caring for me. And emotional intimacy, it is very important to predict and precede the physical intimacy. This is something which we have to make the couple understand. So just few take-home messages from my side. The most important sex organ is brain, and it is not the penis or vagina. The intimacy needs time, trust, and tenderness. All 3 T's are very important to have the feeling of intimacy and to get the ecstasy and satisfaction from intimacy. So science and sensitivity of the person who is trying to solve the issues is very important, and that will always give a better outcome if a couple is known to us or comes to us for any of their personal relationship or sexuality issues. So romance and sex, as I mentioned earlier, there is no age bar. And as you see here, the couple who is shown by me here, this is not. Now, most of the pictures are picked up from the Google. That is why you will see most of them are foreign films, foreign pictures. But then, yes, Indian scenario is also changing now. And we see so many couples starting their second innings in their 60s and late 50s. So sexuality evolves. It never expires. This is the last statement before I conclude. And healthy intimacy is not just a luxury, but it is a preventive medicine. And that is what I'm dedicating my life to, prevention rather than cure and solving the problem. So once again, I thank everyone, the President and Secretary of IMA Maharashtra State, AMOGs, the conveners of today's workshop, all the guests of honor, and all of you, audience, and everyone, for giving me the opportunity to interact with all of you. Any questions? If there is time, I'm ready to take up. Thank you so much.
Thank you so much, madam, for such an exhaustive and very elaborative talk. You have covered everything, every aspect about this intimacy and relations and whatever is needed for the sexual pleasure. There are few questions.
Okay.
What do you think about the when we refer some patients for this sexual problems to the other specialties like psychiatrist, psychologist, or endocrinologist? Uh, is, how is their role in that?
Of other specialities?
Yeah.
Okay.
We are gynecs, and
Yes.
whenever we are seeing this sexual health patients.
Yes, definitely. See, the couple who is not happy in their personal relationships, what happens is they do not understand, neither they do correlate any of their day-to-day symptoms or the issues to sexual issues. But most of the times, the underlying cause could be the dissatisfied sexual relations. And that is why the patient may present to a family physician, a general physician, or any other specialty for any surgical condition also. But then if, as a doctor, if we know that like for example, the patient is presented to a physician for say hypertension or control of his sugar. So in that case, we as doctor, we know that the antihypertensives or the raised blood sugar itself can have, the person could be suffering from erectile dysfunction, though he may not present to the physician. So proactively, we need to ask the patient that, do you have any issues? Or there could be, as I told you, the implicit model, the P part of it, permission. We permit them to ask questions which are not disclosed in the very first consultation or the initial part of the consult, the issues which are expressed by the patient. So we have to give them the confidence that some patients having, say, high blood pressure or high sugar, they also have sexual problems. So have you experienced any of such type of problems? Are you happy or are you able to perform? Or rather than leading question, generally in counseling, we ask them to some open-ended questions. So how is your sexual life? That could be a better way of asking. Is the wife, many a times the husband may not disclose, but the wife comes out once she knows. She may not ask in front of the husband, but then later on she may come for some other complaint or just to consult you and ask you that, yes, you asked about that thing. Now I feel that my husband has such type of a problem. So this could be the way that we need to anticipate and ask the patients proactively if we can correlate that this person could be having some sexuality issues also.
Yes, and if we suspect if there is any psychiatric issue or any, for example, thyroid disorder, yeah, we can have the opinion of any endocrinologist for the better control of this.
Yes.
Again, what do you think about the role of social media
Role of
in this role of social media
social
in this
media. Oh
awareness
my God.
about this?
Yes. Social media is, see, in today's time, I would say that almost 80% of the couples, they do have relationship issues, not just sexuality. So the relationship issues are, social media is one of the biggest responsible factor for relationship issues, because the persons in the relationship are not really bound to each other. They are giving more time to social media and they get carried away by whatever information is shared. Unfortunately, the information which they get from social media is not always very authentic and it is only for creating TRP. So, सनसनाटी create करण्यासाठी. Same thing happens with say, I mentioned about the porn films also. So whenever you see the models or the girls or the ideas related to the body images, now they are also imposed from the social media, right? What is the idea of beauty? Body shaming is one big problem which we need to counsel to the patient at my center. And so many people get affected. Why? Where is the comparison? It is not with the mummy or elder sister or anybody around. It is with the person who is the images which are sent on the social media. So yes,
There is
social media
misinformation many
is
times.
very much responsible for creating myths, misconceptions, and unrealistic uh, expectations, especially in sexuality also. So one has to understand the role and limitations of social media. That is the way, and that can be taught and explained to the persons.
Yes. Santosh sir, are you there?
येस सर, बोला मदन सर.
सर, तुम्हाला काही क्वेरी असेल तर विचारा ना. विक्रांत सर, संतोष सर.
मॅडमचं खरं तर अभिनंदन. खूप कमी वेळामध्ये डिटेलमध्ये सर्व गोष्टी कव्हर केलेल्या आहेत मॅडम. वैजयंती मॅडम, अभिनंदन. परंतु मला काय म्हणायचं मॅडम, की प्री आणि पोस्ट मॅरेज काउन्सिलिंग जे करतो आपण, त्याच्याबरोबरच मला असं वाटतं प्री आणि पोस्ट मेनोपॉज, अँड्रोपॉज ह्या एजमध्ये सुद्धा, म्हणजे 40.2-40 ह्या एजमध्ये आणि प्री आणि पोस्ट मॅरेज काउन्सिलिंग कितपत गरजेचं आहे. कारण आपण बाकी गोष्टी बघतो लग्न जुळवत असताना,
येस,
आणि बऱ्याचदा काय होतं की लग्न झाल्यानंतर जनरली आता माझ्याकडे पण हेडेकसाठी येतात आणि मी काउन्सिलिंग करतो, तर खूपदा असं होतं की ह्याच्याबद्दल थोडंसं जास्ती इन्फॉर्मेशन नसते सेक्शुअल ऍक्टिव्हिटी बद्दल, आणि त्याच्यामुळे प्री आणि पोस्ट मॅरेज काउन्सिलिंग खूप गरजेचं आहे. ज्या पद्धतीने तुम्ही त्यांच्या प्रत्येकाच्या पार्टनर्सच्या एक्सपेक्टेशन सांगितल्या, पण बऱ्याचदा लेडीज व्यक्त होत नाहीत त्याच्या सेक्शुअल ऍक्टिव्हिटी बद्दल, आणि त्याच्यामुळे खूपदा स्ट्रेस रिलेटेड बाकी सर्व गोष्टी सुरू होतात. तर प्री मॅरेज पोस्ट मॅरेज काउन्सिलिंग किंवा लेट, जसं आता आपण हे सर्व गव्हर्नमेंटने मेनोपॉज क्लिनिक चालू केलं, तर तो स्ट्रेसचाच पार्ट आहे. तर प्री आणि पोस्ट मेनोपॉज आणि अँड्रोपॉज काउन्सिलिंग हे फार गरजेचं आहे असं मला वाटतं. आपलं काय मत आहे मॅडम?
तर डिव्होर्सचं प्रमाण कमी व्हायचं असेल तर काउन्सिलिंगला पर्यायच नाहीये. फक्त आता नवीन ट्रेंड जो आहे ते मुलांना, पुढच्या जनरेशन ज्या आत्ताच्या आहेत त्यांना लग्न सुद्धा करणं हे तेवढं गरजेचं वाटत नाही. म्हणजे आताचं काउन्सिलिंग त्यांनी लग्न करण्याबद्दल पण बरेच पालक येतात की हिला लग्नच करायचं नाहीये. सो ऑफकोर्स ज्यांना लग्न असू देत, लिव्ह इन रिलेशन असू देत, किंवा एकूणच त्यांना स्वतःच्या पद्धतीने एकट्या एकट्याने जगायचंय, पण ऍट द सेम टाइम रिलेशनशिप पण आहेत त्यांच्या, एक असतील जास्ती असतील, तर तिथे काउन्सिलिंग हा खूप महत्वाचा भाग येतो. कारण त्याच्यामध्ये राईट फ्रॉम प्लेजर कसं मिळवायचं पासून जबाबदाऱ्या काय आहेत, त्यावेळेला काही अनवॉन्टेड, जसं प्रेग्नन्सी, आता खूप ओल्ड झालं, पेशंट्स खूप शहाणे आहेत आत्ताचे, त्यामुळे त्याबद्दल कॉन्ट्रसेप्शनवर फार काही मला सांगावं लागत नाही. पण सेक्शुअली ट्रान्समिटेड इन्फेक्शन्स असतील, म्हणजे मेडिकल कंडिशन बद्दल पण सांगणं हे महत्वाचं असतं. आणि त्यासाठी मला असं वाटतं की IMA असेल, अमॉक्स असेल, आपण सोशल मीडिया जसं चुकीची माहिती देत आहेत तसं सोशल मीडिया योग्य माहिती पण देऊ शकतो. आणि देर आर व्हेरी गुड प्लॅटफॉर्म्स अवेलेबल. आणि आत्ताच्या काळात तर यूट्यूब चॅनल्स असतात किंवा हे असतात, तर ऑथेंटिक चॅनल जे आपल्यासारख्या ऑर्गनायझेशन्स, इंडिव्हिज्युअली तर आपण करतोच आहोत, पण आपल्या संस्थांकडनं पण हे आपण एक जबाबदारी म्हणून नक्की करू शकतो. आणि करतात पण आहेत आता. तर आपल्या सोसायटी, इंडियन सोसायटी, आपले जे ट्रॅडिशनल कन्सेप्ट आहेत, आपली जी समाज रचना आहे, आणि आपण कुटुंबप्रधान संस्कृतीला महत्व देतो, अशा वेळेला रिलेशनशिप, सेक्शुअलिटी या गोष्टींचं महत्व काळाप्रमाणे जे बदललेलं आहे ते सुद्धा शिकवणं हे सर्व वयामध्ये, विशेषतः तरुण पिढीला खूप महत्वाचं आहे. आणि त्यासाठी आपण नक्कीच सोशल मीडिया सारखी माध्यमं वापरून, सगळीच माध्यमं म्हणजे वापरून, आणि हे करू शकतो. काउन्सिलिंग ही फार महत्वाची गोष्ट आहे, नक्कीच.
येस, अगदी बरोबर आहे. ऍडोलेसंट्सना जास्त आपल्याला फोकस करणं गरजेचं आहे सध्या.
येस,
आणि सेक्शुअलिटी एज्युकेशन ते अजूनही आपल्या म्हणजे गव्हर्नमेंटने जास्त मनावर घेतलेलं नाहीये. तर तिथे एक आपला रोल आहे, आपल्या ऑर्गनायझेशनचा रोल आहे. तर एकंदरीत आजचा प्रोग्राम छान झालेला आहे. थँक्यू सो मच फॉर युअर वंडरफुल गायडन्स अँड वंडरफुल टॉक. तर on behalf of IMA Maharashtra State and AMOX, I would like to extend my sincere thanks to office bearers of IMA Maharashtra State and office bearers of AMOX, and also the chief guests and guest of honors for today's session. I would like to thank all the delegates and all the entire office bearers of both the organization and all the delegates who have joined from all over the nation. And we have really enjoyed this session. Thank you once again. Thank you so much. Thank you, Corona Remedies, for support. Thank you, Rakhi, for coordinating this event. Chalo, thank you so much. भेटूया परत.
Thank you, Dr. Madan. Thank you,
Yes.
Vikran, Dr. Kulkarni sir, Amey, everyone.
Thank you. Thank you.
Thank you, everybody. Thank you.
Yes, thank you so much.
Thank you.
Yeah, we are ending the meeting now. Thank you. Yeah, good night.
Good night.
Thank you, Darshan from Corona. Thank you so much.
Yes, sir. Good night, sir.